In the heart of Meghalaya, a revolution is unfolding. A year ago, a visionary initiative was born, MMDSL, Meghalayan Medical Drugs and Services Limited. We are proud to celebrate a year of transformation, a year of unparalleled dedication to healthcare accessibility. But before MMDSL, healthcare professionals face a myriad of challenges in procuring essential medicines and supplies. Remote villages struggle with irregular deliveries, limited stock, and exorbitant prices. Doctors and pharmacists grappled with the daunting task of serving communities with insufficient funds. In a region marked by its unique challenges, MMDSL emerged as a beacon of hope, weaving a network of healthcare accessibility across the picturesque landscapes of Meghalaya.
In Meghalaya, when we wanted to transform health sector and to bring it to a much higher standards and improve outcomes, one of the things which has a big impediment was the quality and the availability of drugs at the health facilities throughout the year. This was one of the mandate of our Honorable Chief Minister, Mr. Conrad K. Sangma, where he wanted to have a real-time update of how many drugs are moving, where it is happening, and how it is going through. We had to come up with a standard essential drug list. A committee was formed at the level of the commissioner with the doctors from the field and at the senior most level, all of them being there, and a standard essential drug list was brought. Now we are in the process of making other essential lists like surgical list, equipment list, and consumable list. We are also set up a helpline through 14410, which is a standard health helpline for the state. One of the components within the helpline is the Meghalayan Medical Drugs and Services Limited, where people can actually tell that whether they've received the drugs, there is a shortage of medicines, or whatever is there within the system, they can complain. Even public are welcome to point out the matter so that we can actually attend to these issues.
MMDSL has revolutionized remote delivery services, ensuring swift and efficient transportation to distant regions. Alongside improved storage, meticulous equipment maintenance, strategic planning, and a robust grievance mechanism system, MMDSL enhances accessibility and reliability in healthcare supply chains.
Hi everyone, I'm Tawqir Ahmed.
Hello, I'm Tina Kumar. We are from Plan India and we are collaborating with MMDSL to strengthen the supply chain management for essential drugs with a vision to bolster the health programs within the state.
In the first for the state, we are actually delivering medical supplies up to the PHC level from the corporation and its warehouses. So we have embarked in the process of transforming the warehouses. In the last 1 year, we have delivered over 5,500 deliveries across the state.
We're also in the process of developing a third-party delivery system whereby, based on its indent, the delivery of a facility is planned right up to the week and day of each month, making the delivery system predictable and consistent.
Before MMDSL, once the medicines reached the district, we had to collect the medicines by ourselves, as in we had to send our ambulances and collect the medicines from district, which was quite difficult for us to manage. But with the start of MMDSL, now once the medicines have reached the district, these are being directly supplied or distributed to the facility, which has made it a bit easier for us.
Dan balik sim kita wai mo mata kala poi hi hang ni ti ngapet kita wai ro kilong ki ba ki quality jong kita wai ro kilong ki ba kham ba ha ki packing ki ai ro ki biang.
Meghalaya is one of the few states in the country to have brought this kind of a systemic intervention, especially for providing medical drugs, in a timely manner to all the health facilities. Through the MMDSL, we have seen, there is a significant reduction in the procurement cost of the drugs as one, and more importantly, we are able to supply the drugs, in time to all the health facilities because there is a dedicated system that is working for supplying these drugs.
Ni nadu pula introduce ya gani ka system aku melong menta kelai rap sibun yang ni nadu ban inden ni kedawai bat kumjuk ro dia ban receive kedawai bat kumjuk ro dia ban pa Begini kita why had in receive in the state, manfaat segi facilities repair.
MMDSL's impact on strengthening healthcare infrastructure in Meghalaya is profound by providing both technological and technical support. MMDSL has empowered healthcare facilities across the region to navigate the complexities of modern healthcare delivery. Overall, MMDSL's multifaceted approach to strengthening healthcare infrastructure in Meghalaya underscores its commitment to advancing healthcare access, quality, and equity across the region. Through collaborative partnerships and sustained investments, MMDSL continues to make a meaningful difference in the lives of individuals and communities in Meghalaya and beyond.
The cooperation application is a software that's been developed in-house by the IT team of MMDSL. It also acts as a supply chain management system in which each and every facility across Meghalaya can monitor the stock level of medicines, and also from MMDSL we will be able to track the stock position and also availability of medicines from the purchase order up to the actual delivery to the medical facilities. Our MMDSL dashboard encapsulates all activities which are done by the departments of MMDSL.
This application is very helpful because through this application we will come to know about the consumption, we will come to know about the requirements, what is being needed by the facilities.
Cooperation application ro kala lab hashibod kumno ngile ke try happen update man kasngi ki the number of deliveries being delivered support PSC, support CEC, support hospital.
I would like to say that MMDSL has done a great job, especially when it comes to indenting of the medicines.
Things have become much easier as now we can approve the medicines and we can see what are the drugs available and what are the drugs being indented by the pharmacists.
I would really congratulate the team, especially the medical officers who are serving in the remote areas, who are able to indent the drugs what they require from the corporation using a complete online portal. So that's why we could able to see that whatever the medicines that are required at a remotest places also could be provided in a time-bound manner.
Over the past year, MMDSL has implemented a series of systematic improvements and activities aimed at enhancing healthcare delivery and infrastructure in the region.
MMDSL has an in-house technical team. They are responsible for the maintenance of all biomedical equipments. This team is located in all the districts in Meghalaya. Meghalaya is the only state which are not depending on PPP mode, that is a private-public partnership, in the maintenance of biomedical equipments. This has led in a cost efficiency and a faster response time.
MMDSL ko takaranichi tinga dengtang positive changes rang ko nakaha. Dauk tage tinga equipment technician rang donga. Je dauk tage jensalo tinga equipment rang dauk tage breakdown ode banusto ode tinga wa technician rang ko call ka yokomata ro jensalo tinga call ka no de bishong le baimana technician rang ibaimana ya rang ko repair ka idonga.
Resources has been clubbed under one umbrella. I mean resources from DHSMI, DHS, MCH and Family Welfare and DHS Research, including the society like NHM. All the funding which were allotted before has come under one umbrella under MDSL. So we can get to the optimum efficiency for procurement and for spending of the fund.
The introduction of central procurement models has really streamlined the process of procurement and also bring about the conditions with the health facilities. One of the most impressive achievements in the area of procurement is the significant reduction in the rates through a strategic tender process, which has lowered the rates of about 70% of the drug list, reductions of minus 45% in the rates compared to the old rates.
The Meghalayan Medical Drugs and Services Limited was established by the Government of Meghalaya to transform the healthcare accessibility in the state. And over the last 1 year, it has done a yeoman's service to the people of Meghalaya by ensuring accessibility, affordability, and quality in the healthcare delivery system in Meghalaya. Now, a year later, I'm proud to see the progress, and I extend my appreciation to MMDSL and the Health Department for their dedication in improving Meghalaya's healthcare delivery system. Their achievement marks a significant milestone in our collective effort to enhance healthcare services in the state.
MDSL has taken giant strides toward strengthen the supply chain management for essential drugs, leveraging the technology for data recording and reporting, better forecasting for procurement, and adopting the private sector approach for transportation and distribution to ensure the product availability at last mile.
Now, if we see the store, we can see the rack and then we can see proper installation of fire extinguisher, proper ventilation, and so many renovation has been made here in the store.
We can keep it all the medicines and separate spaces, because there is more enough space. We can utilize the space. Previously we could not utilize the top of this thing because it is too high. Now we can utilize all the spaces. Now the medicines also we can keep more than previous. Now at least I think 2-3 trucks medicines we can keep nicely.
We can see this room. There is one which we kept for quarantine room, and one is the drug which has failed the test. This quarantine room is the room which we store the medicine at the time when we send for testing. So if it get passed, then we issue it to the district. And if it get failed, we kept in the other room which is mentioned not of standard quality.
So in the previous years, drugs from the state are being sent for testing to State Drug Testing Lab Pasture and to Regional Drug Testing Lab Guwahati. However, after the inception of MMDSL, it has become important that additional tests are being carried out. So now we have extended our testing to other NEBL labs of the country to ensure that the drugs supplied by the government are safe, effective, and of standard quality.
Nikong biomedical waste management layo aban streamline bahaya di expired medicine de is yakani ngala aban constitute committee ka bakantop lang ki government official kajing trelang jungi assistant drug controller bat ki district drug inspector kajing takajing trelang ru bat ki district medical health officer ki badan hapogi district bapher
Kao the expired drugs sangkoba chinga nek asan ding thang dot mansa donna deba daude gen salo MMDSL sokpaha bisong biomedical waste management my by mangna daude bisong expired drugs sangkoba khale kain so.
I'm very pleased to have witnessed the significant progress and achievement of the Meghalayan Medical Drugs and Services Limited, and this is mainly due to the collective work effort put in by all the team concerned, as well as the invaluable support of our Principal Secretary Health and Family Welfare, the Commissioner and Secretary Health and Family Welfare, as well as the Secretary Health and Family Welfare, who is also the Managing Director of the MMDSL. I extend my heartfelt appreciation to the entire team. Together, let us work to continue and to strengthen our efforts to improve the healthcare system by giving the people of our state a healthier and more promising future.
I want to congratulate the Meghalaya Medical Drugs and Services Limited, or the MMDSL, for playing a pivotal role in bolstering the health ecosystem in Meghalaya over the past year. MMDSL has made an impact to ensure consistent access to quality, affordable medicines and medical supplies. This centralization of the procurement and distribution process enhances access to essential healthcare resources, leading to improved treatment outcomes and overall healthcare quality for the people.
I would like to take this opportunity to congratulate the MMDSL on their 1-year completion. This has been, in fact, a process which is part of a larger goal to improve the overall medical and the health facilities and the overall healthcare scenario in our state. And we understand that medicine is a very, very important part of that. So what MMDSL today is doing is actually making the entire process of procurement and distribution of medicines up to the grassroots level much more efficient. And therefore, in the last 1 year, we have achieved a lot, and we expect many more things to happen in the future. With this entire process, we will be able to ensure that the people get medicine at a much more affordable rate, and much more accessible, easily available, and many more health benefits that the people will get. So once again, I wish the MMDSL a big congratulations on the 1-year completion, and we look forward to many more successful years in the days to come.
The ongoing transformation of healthcare and the building of healthier future for Meghalaya are the result of collective effort involving dedicated team members, healthcare professionals, and government partners. Together, they work tirelessly to address the diverse healthcare needs of the population and overall the challenges that lie ahead. Together, this collective effort embodies a shared vision of a healthier, more resilient future for Meghalaya. Through collaboration, compassion, and perseverance, they strive to address healthcare disparities, promote health equity, and empower communities to lead healthier lives. Their ongoing commitment and collaboration serve as the cornerstone of progress and hope for a brighter tomorrow in Meghalaya's healthcare landscape.